Ironwood Cancer Insights. My name is Kayla, and I'm your host with Ironwood Cancer and Research Centers. And today we have a special guest, Dr. Heidi Rula, our Medical Director of Supportive Care Services, in honor of National Cancer Survivor Month. So June is National Cancer Survivor Month, which is a time to celebrate our survivors. So thank you, Dr. Rula, for being here today.
Thank you for inviting me.
Yeah. Just to start out, can you kind of go over what survivorship is?
Yeah, I would say that a lot of patients are confused as to whether or not they're a survivor. When does that start and when does that end? And really, survivorship, we don't have one common definition of it. Most people are going to define it as a patient becomes a survivor from the moment they get diagnosed with cancer to the end of their life. But in terms of programming, it really helps to kind of define survivorship activities come more after a patient may complete their active cancer treatment, and then we kind of roll into a lot of the different programs that will help support our cancer survivors.
Awesome. So you play a very big role here as the Medical Director of Supportive Care Services. Can you kind of jump into what you do with our survivors?
Yes, so I am the Medical Director of our Supportive Care Services Department, which really has been created to help our cancer patients from the time they're diagnosed, well into survivorship. And our program here really incorporates myself. I'm an integrative oncologist, which means that I do supportive cancer care. I work with our patients, helping them through the different steps of their cancer diagnosis, from active treatment well into the things of recovery from their cancer treatments, looking at restoring health, dealing with any kind of long-term side effects. And then we also work on our different programming for our survivors. So we have different classes and courses that we create for our survivors. One of them is our breast cancer survivorship program, which is a 12-week lifestyle program which really educates our breast cancer patients on all the different active steps they can take to deal with the different aspects of their health and preventative strategies as a survivor. We also, as part of our department, have our social workers, which will support many different aspects of a patient's life as they're going through cancer treatment, not only with kind of resources, both financial and different community programs that are out there, helping connect them with different services that they might need, including transportation. They help deal with the emotional impact of a cancer diagnosis, supporting our patients in that way. And then we also have many different classes and support groups, which can be really beneficial kind of as our patients may need some additional kind of services that are above and beyond just kind of having treatment for their cancer. Additionally, we have our dietitians, which are really invaluable resources that can help patients if they're struggling with different nutritional needs, whether it be through chemotherapy or radiation, with our survivors as they're having questions about what's the optimal way to eat after a cancer diagnosis. So they can be, again, a really important resource to help in that education space for our patients. We also have our genetic counselors that work with our patients after they have genetic testing to look at risk factors for cancer. They can tell them about what type of strategies they might need to take or what type of testing they should have, or other family members may need to get tested as a way to prevent a cancer from developing.
Well, it sounds like every step of the way through survivorship, you guys really have every base covered, and you can help them every step of the way. So when they're going from active treatment to survivorship, what does that transition look like?
Well, I think a lot of times when a patient finishes active treatment, they go from having very regular medical appointments to now those appointments getting spread out quite a bit. And it's really kind of in that space where you're starting to visit with your medical team less, that a lot of patients start to kind of go, okay, what's next? Sometimes it can create a little bit of anxiety, not being kind of connected with your doctor to make sure that you're being checked on to make sure your cancer hasn't recurred. And so we really like patients then to kind of connect with our programming, because at that point they can start to deal with some of the stress around fear of recurrence. We have a number of classes that we create in our survivorship program, really addresses how to manage fear of recurrence. Those are the questions a lot of times that come up with the lifestyle. How do I eat? Is exercise important? How do I deal with my stress? We try to kind of incorporate those type of kind of educational pieces to support patients in answering some of the questions they have in terms of what kind of lifestyle changes they can make now in the survivorship phase that may make a difference in how their outcomes go.
Well, it sounds like knowledge is kind of key with helping them through this next transition into this phase. When somebody is going from seeing a medical oncologist to an integrative oncologist like yourself, I'm sure the appointments might look a little bit different. Can you kind of go through what a survivorship appointment might look like for a patient?
Yes, again, as an integrative oncologist, my role is to support the medical oncologist in whatever the cancer treatment plan, has been created. So my support really looks, a much more kind of holistic view of how we can help a patient. So I have, prolonged visits. We spend 60 to 90 minutes in a consultation where we really try to understand the person, what their health challenges are, how they currently, are taking care of themselves in terms of nutrition, stress management, sleep, exercise, what's their current level of knowledge, what kind of, questions they may have, how do we kind of connect them with, the data influenced decisions and to be able to have them incorporate some of those changes where we have evidence that this can make a significant difference in their overall survivorship. So sometimes when patients, learn that things like exercise may reduce risk of recurrence by 20 to 30%, that's really empowering. That really, motivates a person to say, hey, I've been a pretty sedentary person. I want to do a few things, that might kind of change my outcome. And so we try to work with them on creating some strategies around that. We work with them on kind of what's their current dietary supplement, intake. Are there things that they can take? Are there certain vitamin levels that might be off that we might want to address? So we really want to look at all those aspects of lifestyle to help them. If there's different stressors, we connect them with different kind of mind-body techniques. Different resources to be able to deal with the stress. And again, just help identify maybe different, programming that's available in the community that also might be a resource, as well as different services within Ironwood itself that may be helpful. Again, we have many different support groups that, once you're complete with active treatment, and maybe there's now some time in your life where you could maybe, have that time to be able to attend a support group or be in an emotional space now where you feel like connecting with others might be supportive for you. So we explore all those different avenues and try to come up with a care plan that is individualized to the person. Not everybody needs support in the same way, and so we try to really create a plan that is specific to the needs of the individual.
Yeah, it sounds like it's a safe place where people are able to bring up concerns or any questions they may have and work on those next steps. So that's great to know for our survivors. I know you touched a little bit on some of the support classes. Can you touch a little bit on maybe the groups or classes that we have inside Ironwood?
Yeah, so we always have kind of a changing list of things, so we definitely recommend that patients can log into our website, the ironwoodcrc.com, and there we have, in our kind of support programs, you'll see our calendar of activities that will show you kind of month by month what's available. But we generally are trying to, create programming around helping patients deal with the stress of their diagnosis. So we have things like drumming, we've had different sound bowl therapies, we regularly have our yoga, our tai chi, a Reiki that's virtual online. All of these can be incredibly helpful to deal with some of the stress around a diagnosis. Our social work department puts on a number of different cancer support groups. Definitely we have our breast cancer support group. We've created recently a head and neck cancer support group. Again, there's a number of different support groups that are changing on a regular basis. Our prostate cancer group has been quite active. We have a very good engagement in that group, and so really explore that website to see if there isn't a support group that we list, that we offer. Our social work team is very good at identifying other support groups around the community or virtual groups that are national groups that they could be able to connect with to provide them, with that type of support that they're looking for.
Well, it sounds like there are a lot of resources available for them that they can take advantage of, which is very great to know. So June is National Cancer Survivor Month. And I think it's important to help our survivors year-round. Is there something that loved ones can be doing, just little things that can help cancer survivors?
Yeah, I mean, I think it's important to know that each person may need support in a different way. Again, just asking those questions of how I can help you, and be able to kind of see where their needs are at. A lot of times when a patient completes cancer treatment, there is the expectation that they're going to kind of step into their life as it was previously, or that when they're done with treatment, they start to look like their normal selves. And so, a lot of times, friends and loved ones can, expect that they're going to just be able to step into their life as it previously was. But a lot of times there's still healing that is occurring, on the inside, and that, the cancer patient may have gone through some significant changes emotionally, that they're on their own emotional journey. So I think it's important to understand that just because they've completed, treatment, they may look like, they're healthy from the outside, that there's a lot of internal healing that's going on, and to be able to continue to reach out to that person. Now that active treatment is done, a lot of them just are looking for more of that social support. They want to, be able to kind of gently maybe return to some of their social activities. So asking what works for them, where, what kind of outings or kind of connection do you want me to call you weekly to check in, or is that too much? Do you want to just go for coffee occasionally? Is there any kind of help still that you need around the house? Sometimes helping a loved one with continuing different house cleaning activities or things like that maybe they're still not in a place where they feel strong enough to be able to assume all the roles that they had before, and still need some support on other levels. So asking those questions can be a way to make sure that that person is getting the support they need, and again that the loved ones are able to direct their support in a really kind of useful way.
So it sounds like with empowering survivors, knowledge is kind of key. Mm-hmm. If someone is looking to connect with, survivorship services that are available, how can they do so?
Yeah, I mean, we definitely recommend they reach out to our department. The Supportive Care Services Department at Ironwood, again, has a variety of different services that we can kind of discuss with the individual and see what type of programming might be of help. If you look at our website, ironwoodcrc.com, again, we list a lot of that programming, but just reaching out, you can send an email to wellness@ironwoodcrc.com. That connects you with our department. We can have a social worker kind of reach out to you and kind of go over a variety of these services and see, again, where your needs are, what might match up with that. Consultations with myself, to do an integrative oncology consultation. Patients can either reach out to our department, they can do the wellness at ironwoodcrc.com, or they can just speak to their oncologist and have the oncologist send in a referral to our office, and we will connect with the patient and get them scheduled.
Awesome. Well, thank you, I'm going to start over. Awesome. Well, thank you so much for being here and discussing. I can't talk today. Well, thank you so much for being here, Dr. Rula, and discussing this important topic. I think it's going to be a great resource for people to get information for. So thank you so much.
Yeah, it was a pleasure. Mm-hmm.
And if you guys are looking for more information on Dr. Rula, or you want to get in touch with Ironwood, you can go to our website at ironwoodcrc.com.